It's estimated more than 240 million people contract malaria every year, with the mosquito-borne infectious disease causing more than 620,000 deaths annually. But a new non-invasive test could help lower that number significantly, especially by detecting the disease in asymptomatic patients. I'm joined by Maggie Lord, research scientist and senior lecturer at the University of Queensland, to talk about the needle-free malaria detection tool. Maggie, welcome. Firstly, tell us how this technique works.
So this tool works by simply shining a beam of light onto someone's skin, either their ear, the finger, or their arm. We send the light through the skin. You don't feel any pain. We get a computer algorithm in form of a spectral signature, and we analyze that for infection.
So how much of an impact do you think this tool will have on the diagnosis and management of malaria worldwide?
Well, we hope that we can use this tool to scan more than 1,000 people in a day, and that means that we can tell how many people are infected in the whole village, and then we can send them for treatment, and that will reduce a lot of transmission that happens in endemic areas.
And how soon do you think this will be commercially viable and available?
We are hoping to do a scale-up study in malaria endemic areas, and once that's proven, then we hope that we can scale this up for commercial use. So hopefully 2 to 3 years, or worst case scenario, 5 years.
So you say 2 to 3 years. What's the process of making that happen? What do you need to do to get to that point?
So right now we are scaling up field trials in endemic countries. We need to collect more data to show that skin color or blood type or the number of parasites doesn't affect prediction algorithms that we have already developed. And once we have that, we hope that we can develop user-friendly spectrometers, with even thinking of developing something that can be worn, something in form of a watch. Someone can just wear, and we can detect infections remotely.
Why are invasive methods of testing for malaria, like injections, such a barrier in many third world countries?
Look, it's not a barrier. It's all about those people who are sick, but they actually don't have symptoms. So these asymptomatic patients will naturally not come forward to get tested. And if they don't come forward to get tested, mosquitoes will still bite these people. If mosquitoes bite these people, mosquitoes will get infected. Mosquitoes will bite younger children. The children will get infected, and children are the ones that die from the disease.
Maggie, in which specific countries is malaria the biggest problem across the world?
Currently, malaria is a big issue in the African continent, where 90% of malaria cases are reported, followed by South America and Southeast Asia.
With the COVID-19 pandemic, malaria in many ways has been pushed into the background, but what's the overall status of this disease at the moment across the world?
Look, it's been worse since COVID-19. The cases went up, the number of deaths went up, and this is because all the interventions, most interventions went to COVID. So the interventions we had in place for malaria were scaled down so that all the resources were focused on COVID. So in 2022, we saw malaria cases and number of deaths go up.
Best case scenario, your new non-invasive tool is scaled up and going to many parts of the developing world. Where might malaria be in 5 to 10 years' time in terms of a problem for the world if everything goes well for you?
If everything goes well, we hope that we can use this tool in the field, not only for asymptomatic patients, but for symptomatic patients as well. So if we can use it for asymptomatic patients, we hope that we can find those people, ask them to get treatment, and hopefully reduce the number of cases to, more than 50% of what we're seeing right now. We also hope that we can use it for small children, so small children don't have to get pricked for a blood test, and use it for surveillance of malaria. And this would ultimately help with the, guiding the current malaria elimination strategies set forth by WHO.